Hi, Jennifer.
Hello.
Thank you very much for coming to Kansas and talking to us today. We really appreciate it. And we would like to know if you could just give us what you think is the top three ideas that we can take away from what you had to say today.
Sure. Well, we actually talked about a three-step process for implementing authentic assessment practices, and so I can talk a little bit about how we can, something that you can do related to each one of those steps. The first one we talked about was observing and gathering information about children. And I think the take-home message there is that if you're not doing it already, it's important that you select and use a high-quality curriculum-based assessment. We talked about some of the issues to consider when selecting a curriculum-based assessment, that it be one that has got good technical adequacy to it, but also that it is an assessment that you can use with a wide variety of children, whether that's children of different chronological ages or children who perhaps have skills sets that are across different age levels, or within a classroom if you have children that are functioning on very different age levels. So finding one that is flexible across all those age levels is important. Secondly, that you choose an assessment that is sensitive enough to show change for children with disabilities. Increasingly, children are being educated in classrooms where there are children without disabilities. And so the assessment tool should be one that could work for kids with disabilities, but also without disabilities, but also is sensitive enough that you can measure change for children with disabilities. And third, that you pick an assessment tool that's going to give you both quantitative assessment data, meaning that I'll know the child can do it, they can't do it, or it's emerging, but also under what circumstances the child is demonstrating the behavior. So those are three of the key pieces of information I think you need to consider when selecting a high-quality curriculum-based assessment. The second piece that we talked about was gathering information from families, talking to families, thinking about that as being part of the assessment process. And I think the big take-home message there is to remember that families do have very important information that they can give us, and that we can learn a lot about children by having a conversation with families or being intentional about developing or designing a process for gathering information from families. As part of that, in order for the information that we gather from families to be useful, we have to have good communication skills. We have to employ good communication skills when we're talking with families. And so in our field, a lot of times we only think about how we're going to interact with children, but as part of the assessment process, we need to think about positive interaction skills with adults as well. The third thing that we talked about today was the review process. So how do we actually use the assessment data that we have collected on children? And I think the take-home message from that is that we collect a lot of assessment information in early childhood. And it's important for us to realize that there are some skills that children are going to learn just because they're in a high-quality program or they're in a high-quality environment, whether that be at home or a child care program or a family daycare program or wherever it may be. There are some skills that children may learn because we've adapted and we've provided them some more repetition and more access to using the skill. And then there are those skills that children are not going to learn unless they're not going to learn unless we provide some very intentional, individualized instruction. And it's those skills that should be the priorities for children. And it's those skills that the child, unless they learn those skills, they will not be able to access the general education environment. And so a good, high-quality, authentic assessment should help us focus on those three kind of skill levels, if you will. And so I hope that people will learn to use their assessment data better. I hope that people will talk with families and meaningfully involve them, and I hope that they'll use high-quality curriculum-based assessments.
Thank you.
You're welcome.